Okay, so here we are, ladies and gentlemen. Thank you ever so much for coming. And on behalf also of my colleague Kulja, I want to welcome you. It is always a pleasure to see many of you again, but also to meet new faces. For me, this is a very, very important community. And I know that we are a community. And you know very well, those of you that I have met, that is very, very close to my heart that we actually work together. And you know well, some of you at least, that this issue about rare diseases is very close to me personally, because I have an experience with my youngest daughter who has an illness that is not recognized in Denmark. And it's recognized in Germany and Sweden. So I know the feeling. I know how it is when you know that there is something that can be done, but you can actually not access it. So that was why when I already during my campaign, I said, I want to do more. I want to make sure that Europe actually captures this and that we can make a difference for citizens in Europe as such, but indeed for citizens with rare diseases. And I connected to the people in Denmark, the Rare Diseases Organization in Denmark. And I can just tell you that the people there, as goes for all of you, working in this area made a huge impression on me. People who are all in a situation where it's difficult. Either they are suffering from rare diseases themselves, or they have close relations who are suffering from rare diseases, and still they have the energy and they feel the obligation to work for other people. I think that is something that we should really cherish. And, you know, you're heroes, full stop. So now working with this subject for just over a year, I am more and more encouraged that due to the fact that we are raising awareness. And we should know this. It's happening in Denmark, and I have the sensation that it is happening across Europe. We still have a lot to do. We're not there. We will have to work still hard on this in this area and on these issues. But the idea is getting there for more and more people to understand the why. That the fact that we have rare diseases country by country is not the same when we look at it here in Europe. 36 million people suffering from rare diseases. That's not rare. That's a lot of people. And if we look at it like that, and if we approach the whole area like that, then it becomes completely different. And the ERNs are an obvious example. When we share data, when we work together, things happen. Good things happen. And I have, and Boris, my good assistant, you know him, all of you. Boris knows this from the first time I heard about the ERNs, even together with people who were like, oh, it's not good enough. The system doesn't work completely well enough. And I was like, quiet. We have a system. Let's use it. And let's show that investing in this common system actually makes a lot of sense. A lot of sense for patients, and that's the main topic, but of course also a lot of sense for science and for the places in industry where solutions are developed. So that is going to be one of the topics for today, and I'm very happy that it is, because I think it is a very, very important area to focus on. So the other day in Copenhagen, unfortunately, I couldn't be there in person, but I know many of you were there. And I have the clear sensation also from listening in from a distance that it was a success. And that there was this sensation of, you know, we are being heard, we are being seen, and that is exactly how it should be. So that is wonderful, and we should make it stay like this. Also, when we look into the next MFF. But I can tell you, I'm working right now as we speak on the budget 26. And I can't disclose the details, obviously, but it's probably going to be either this week or next week that we will get there. We will be able to talk more about it. But it is very hard to keep health on the top of the European agenda. So as much as you need me, I need you. I need you to speak up and continue to speak up and continue to talk into this obvious fact that when we work together, we can do more and we can do it cheaper. This is the logic that we have to get all across the European thinking. And in my opinion, not only in rare diseases, this is the beginning. This is a very important beginning, but it goes also into other areas of health where we can do more together when we work together. As you know, I am sitting currently also, and Boris is even more so, sitting with the pharma package and the negotiations there. And it is definitely moving. It can never be an area where things move fast, because then we get sloppy, and we should never be sloppy in areas like this. So it is moving, but it is moving at a speed where nobody really can say whether it's finalized this year or beginning of next year. But it is something that we can see now, finally, 25 years after the first version, and think about how much has happened. And here I can tell you, I'm trying to push for as much as ambition as possible. We don't need a second round just in 1 year's time and need an omnibus. We need to be bold, we need to be clear, we need to have a good vision for the industry, because a strong pharmaceutical industry, a strong sector, means help and support for our citizens, patients. That's how we should think about it. And that connection is, for me, very, very important. And then, of course, we are also waiting for the Biotech Act. Nothing should be pushed to be left for the Biotech Act. We're trying to argue this, because what is it? We don't know yet. We can keep our fingers crossed. We can say, well, okay, we hope. We don't even know when it's due. So, in my opinion, let's do the things as much as we can within the legislation that we're sitting with right now. And then, of course, the Rare Disease Action Plan, there has been a clear call for this. We still just hope that it will come. There is an upcoming INI report. Regardless of what is going to happen from the Commission side, I mean, we can decide to put this continuously on the agenda and make sure that at the end of the day, somebody will have to realize we will need an action plan. So with that in the back of our minds, and with the spirit of really making a difference when we are together, as much as we can achieve, let's go into this meeting. And again, I'm very pleased to host a meeting together with Kulja. Now you're here. Thank you very much. Wonderful. And we work well together on the SANC committee. So wonderful to see you all, and be very welcome, and over to you.
Thank you so much, MEP Bosse. And my name is Clara Romero. I work for FIPRA. I'm a director in healthcare, but I'm here representing Together for Rare Diseases Secretariat. We've been working on Together for Rare Diseases for 4 years, and it really is an honor to be in the Parliament to talk about everything we've managed to achieve as a group, because this would not have been possible if we did not work together. And I think something key you said, MEP Bosse, is about using the tools that already exist. ERNs exist. They have been around for a long time, and it's important that we make the most of them. And I think together we really think it's an important message. We're not asking necessarily for something new, but to make the most of where the EU has already invested in ERNs, in ERDERA, and in all different initiatives. So I think that is really, if there's one message we want to share today, I think that's one of them for sure. On your point about the EU action plan and in the absence of an EU action plan for now on rare diseases, how do you see the Biotech Act and the Life Sciences Strategy possibly helping drive through the working research in rare diseases?
Well, I can tell you in all the areas and all the places that we can talk about it and that we can get it actually into the pieces of legislation that we're sitting with, we're doing that. So we're pushing for the theme to be in the areas where we can actually already see now that they belong. That's the one thing. And then I can say for the MFF, everybody knows the MFF, why it is so crucial. It's the money. And we need to have money behind, otherwise we won't get out of where we are now. So that is another area where we can actually push. And here I just have to say to you, and I am a politician, and here we need the help also from my colleague Kulja. It has only been the Renew Group for the budget 26 who has argued to have health in the budget. So this is why I'm saying I need you as much as you need me. So please, in every corner you can, speak up about the fact that we can do more. We can do so much more when we do it together. And I would argue from now and forever, we can also do it cheaper. We had some people in Denmark doing the calculation. He has a child. You met him, some of you. Sebastian is the father. Walter is the boy, and he used to work with the finance ministry in Denmark. So he did all the calculations, and it's a no-brainer because the idea of people stopping going to the doctor and searching in the hospitals for solutions because they don't have a diagnosis. The idea of that just goes away from the calculations that if you invest in the treatments that are there, even if it's another country, and you know well this, it doesn't matter. When your child is that ill, you want to go anywhere to find solutions. So to get this on board on people's minds, I need you very much, and I will push for it all the way.
And on that note, thank you so much, MEP Bosse and MEP Kulja and MEP András for being around the table. It's really been really different this time around in the Parliament. We really have strong champions in the rare disease space, and I think it's made a huge difference. Perhaps, Sheila, I can now give you the floor to talk a bit more about the work Together for Rare has been doing.
Thanks so much, MEP Bosse, for hosting us today and your really enthusiastic comments. I wanted to really set the scene for what Together for Rare Disease has been doing over the last 4 years and really expose the opportunities that this has sprung for us. Private-public partnerships are delivering value beyond markets. They're doing so much more to deliver value to patients, to the economy, and to the research landscape in the rare disease arena. And it hasn't been possible without everybody working together, bringing their expertise, bringing their knowledge. We really need to think about how public-private partnerships can be recognised, not just as instruments for economic competitiveness, but vital enablers to improve societal progress. So bringing together diverse actors, one of the things we've learned in Together for Rare is that not one person or one partner knows everything. Everybody brings expertise, knowledge, resource, understanding to the table, and we can only learn from each other and deliver those activities. The benefits are seen for patients, for the healthcare system, for the economy, and our citizens who are looking to us to improve the care and improve the healthcare system. And rare diseases, for me, is a fantastic example where those players and actors come together because we have a shared objective. We really want to deliver everything that we can and optimize those outcomes for those patients. I wanted to really share with you some of the activities that we've done over the last few years. And one of the activities was a policy workshop. And that workshop was to prepare for the event for today. But what we've learned through that workshop has been really insightful and really helpful. The workshop outlined the pressing challenges that ERNs and industry collaborations face. Particularly, it emphasised the urgent need for enhanced funding for the ERNs, good, clear operational frameworks, and improved communication channels. It's quite difficult sometimes for industry and ERNs to collaborate. There's a feeling that there is something bad about working with industry. It feels sometimes that and it shouldn't feel like that. It shouldn't feel like that. The idea is that if we can understand what those barriers are, and we can find policy activities that would support those collaborations, then the opportunities for rare diseases are endless. So the next steps were to help prepare some practical tools to help facilitate that. ERNs and industry said it was difficult to engage, and how can we create an environment where there's a good landscape for that collaboration. So we've created a number of tools to support that. And by advancing these initiatives, we've run a few pilots to see how these pilots will work. The workshop participants expressed they really were committed to making sure that the opportunities that ERNs bring to Europe are really maximised and optimised. As the EU's political landscape is evolving, it will be increasingly important, in our view, to engage the European institutions to advocate for better recognition of these unmet needs that people have when they're living with rare diseases. The omission of rare diseases from the mission letters of the newly appointed Health and Research Commissioners highlights that need for continued efforts in engaging stakeholders to push for the EU Rare Disease Action Plan. And we had some feedback from our participants that talked about the concerns about the BOMS group and the rare disease community have about prompted calls to update the statement that enables ERNs to collaborate with industry. And it's fair to say from the people who've worked together for rare diseases, there's been different interpretations at different levels, and it's important that there's a clear interpretation. And actually, ERNs and industry are given the mandate to work together, and only the BOMs can help change that attitude. Encouragingly, though, the growing number of rare new MEPs focused on rare diseases, along with the Hungarian presidency, has really emphasised this issue for us and brought it to a strong momentum. So we expect the Danish and Cypriot presidencies to pursue this strong dynamic, really dedicating the event in European Parliament rare disease research. And it would be a really excellent opportunity to advance that collaboration and improve that rare disease ecosystem. The practical framework that we've developed is a toolkit, and it will be integrated into the EDERA Innovation Toolbox, which will really help operationalise some of these activities. And on the political side, we're here, and we're hoping that we can continue to raise the profile and keep the momentum going with the EU legislation framework proposals. Thank you so much.
Thank you, Sheila. Before we move on to the multi-stakeholder discussion, are there any questions anybody would like to ask? If not, we can move on to the discussion. Just to explain the concept for today, we really want to have a multi-stakeholder discussion. We have asked a few of you in advance to please prepare interventions, but you're all welcome to contribute to the discussion. Our first intervention will be by Dr. Birute Tumian. She's a geneticist from Vilnius University Hospital and the chair of the ERN board of member states, the governing board for the ERNs. As Sheila was just outlining, there is a statement from the board of member states that has been a bit confusing when it comes to industry collaboration with ERNs. There have been discussions in the past within the board of member states on whether to reopen it and clarify it. We were wondering, Birute, if you could give a bit of an update on that, and also possibly see whether a conversation about the pilots from Together for Rare could be envisaged.
Many thanks for nice introduction and for this event. Actually, on the positive note, I should stress that if you go deeper into our protocols, you would notify that the outcome of these negotiations on the statement was together for RD itself. It was decided that we really need real life examples to proceed with our discussions and renew decision making. But on the negative note, I should also mention that a huge challenge there is actually the statement is just an example, one of many, many examples of that challenge. And what do I mean? That challenge is that crucial interlink between healthcare and research. That is not established. Just because there is there is no appropriate dialogue between our DJs, between our ministries and everything. And as you know, conflict of interest management in healthcare is absolutely different in comparison to research. It's much more stringent, and Board of Member States composition is healthcare authorities. Very simple example. Nevertheless, those who are, and I'm looking at our coordinators, those of us who work in rare diseases, know so well that it is at the absolute core of rare diseases that interlink. We are always both researchers and professionals, medical professionals, just because every rare disease patient is that crucial resource for further research. We have to collect data, we have to collect patients. It is our day-to-day work. And it paves the way for further breakthroughs that are shining in media, but all that work, unfortunately, is not. So, again, on the positive note, I would like to also reflect on the important achievements and processes that are currently going in the Board of Member States and in the national systems that actually Board of Member States reflects those national systems. It is, first of all, acknowledgement of that day-to-day work. It is just with the scopes of ERNs and recognition of a huge potential. There are huge potential as an infrastructure leading to clinical research. It is the first step forward. It was not recognized before, and currently, again, I'm looking at my colleagues who are working in, for example, Jardin. We have recognized that indeed all those ERN activities across the whole pipeline, from diagnosing and discovering new diseases, to doing all the regulatory work like data sharing agreements, consents, you know that stuff so well, day-to-day work, to collecting all those consents, data, specimen according to standardized way, to everything that leads to those breakthroughs. It is done in rare disease centers by thousands of professionals every day. If we imagine that work, it would be huge factories dispersed across the whole Europe that is doing that work. And we have to recognize that work. So, again, we have now very active process of developing new national plans in our countries, because unfortunately old national plans are really outdated and too frequently do not recognize ERNs per se, not to talk about ERN related activities. And we have these principles embedded in all new national plans. So it is really a hope that it is taken on board for national in the national systems. However, currently the word behind the future of Europe and the negotiations for multi-annual financial framework is competitiveness. How to embed this persistent, scrupulous, continuous work into that world? That's the question. But if we will not take into consideration this work, it will be just like a cutting of a river that leads us to those final stages of clinical research and breakthroughs that are shining on media, and all that work is left behind the scenes. So my message would be like this. Thank you.
Thank you so much, Birute. Yes, Sheila.
Birute, may I please ask a question? We touched on some of the pilot studies that the Together for Rare Diseases initiative has developed, as well as the paper and the policy framework and the toolkit. I would really love an opportunity for the Together for Rare Disease team to come to the Board of Member States and present those findings, because I feel like if they were to hear some of the opportunities and the activities, it would help you understand how you can move some of these things forward.
Taken on board. Of course, it is just a quite technical question. It will be.
Thank you. Sorry.
Hi. Well, first of all, thank you for the intervention. I think it's been very, very stimulating, the recognition of the link within the care and the research. And but I would like to ask you maybe, first of all, I'm Alicia Granados. I'm Sanofi, but Sanofi R&D Medical. So we are the scientific part of the contributions, but we would like to know how we can help in the elaboration of this. What do you think we can do to help in the you said that you are going to assess the relevance of the statement, how we can contribute?
Actually, you are doing the work, just very shortly, and I'm also looking at ERN coordinators, because for Board of Member States, what we are discussing, everything that happens on the ground, all data comes from ERNs. So we are trying to give ERN coordinators more mandates, more power, really, for self-governance. And it is also the recent trend from the Board of Member States. And for decision making, we really need the data. And data is from you. So I see just a bright future for that.
Thank you so much. This is actually a great segue into our next intervention. Professor Franz Schäfer, Professor of Pediatrics and Chief of Pediatric Nephrology at Heidelberg University Hospital, and the coordinator of ARCNet, ERN, but also a member of Together for Rare Diseases steering group, and also involved in a pilot project in Together for Rare Diseases with Novo Nordisk. Professor Schäfer, it would be great if you could explain a bit more your take as an ERN coordinator on the Board of Member States statement, and in general collaboration with industry, how you've tackled that as an ERN coordinator.
Mm-hmm.
Thank you.
Yeah, so as we have heard, the ERNs really have a unique potential in driving pharmaceutical research in the rare disease domain in partnership with industry. After all, they are consortia of mostly academic partners that have their own research interests and research activities, and they are collaborating in this. But it's also true that the research contributions of the ERNs in the first 8 years have been a little bit lagging behind in comparison to their unique accomplishments in clinical care, education, guideline development, and patient support. Why is that? I think this is mostly due to the fact that research was not part of the ERN's original mission. So the R in ERN is not research, it's reference. We are reference networks. And in fact, DG Santé was initially reluctant to allow the ERNs to allocate any of the funds obtained in the EU for Health program to research, with the exception of registry activities. The reasoning was that all research funding to the ERNs should go through DG RTD. And through Horizon Europe, the ERNs did receive some support via the ERICA coordination and support action, which allowed us to at least develop some basic activities, such as creating a regulatory framework for the ERN registry activities. Original research was also funded through Horizon Europe calls and the joint transnational calls, especially in EJPRD originally, and then since this year in EDERA. In the emerging clinical research network of EDERA, we aim to promote clinical trial readiness by facilitating things like electronic automated data capture from the electronic health records, merging and augmenting real-world databases to regulatory-grade quality, developing and implementing prompts, and also prioritizing rare diseases for ATMP development. So these are ongoing activities, and I think we are improving and we are increasing our interest for industry by all these measures and activities. But what we are still lacking largely are private-public partnerships that would drive therapeutics development by exploiting the unique patient and data resources available in the ERNs. So there we have to catch up. And the unfortunate 2019 BOMS document that we alluded to that discouraged any data collaboration with industry has certainly stalled the development of such partnerships in many ERNs. In our ERNs, we try to find a workaround against this verdict. Since the ERNs are not legal entities, but legally represented by the coordinators' institutions, we decided for our ERN to use bilateral contracting between the coordinators' hospital and industry partners. And this approach has led to successful partnerships, now with more than a dozen pharma companies to date. And these partnerships comprise sharing of registry data, informing about disease demographics, natural history and standard of care, as well as the identification of suitable patients for clinical trials. And recently, we are more and more co-creating activities. We are co-creating prospective cohort studies. We are, with one company, jointly conducting a phase 4 study, and we will also be performing early human trials in gene therapies of rare kidney diseases. So the partners have appreciated our activities. They're coming back to us with more project proposals for new drugs and new indications. So that does work in our ERN. And we have also shared the learnings from our early experience with Together for Rare Diseases to establish models of ERN industry collaborations. So what do we want? I think I see several opportunities for the BOMS, the Commission and the Parliament to promote innovation and EU competitiveness and wider implementation of ERN industry collaborations in rare disease research. First of all, more than anything else, I think a change of mindset is urgently needed. The ERNs should not any longer be denied institutional budget funding for research by the Commission, nor industry collaborations by the BOMS. So this document from 2019 should be revised and changed from discouraging industry partnerships to encouraging industry partnerships. For the next MFF, we would like to see at least some of the ERN's core budget earmarked for clinical trial readiness and private-public partnerships. That would help. Specifically, an EU-wide program to support the creation of a network of ERN centers qualified to perform early human trials could accelerate the access of rare disease patients to ATMPs. That could be a very powerful tool. And finally, I'm convinced that industry interest in ERN partnerships will grow with faster registry enrollment and a better organization and standardization of the registry use conditions. I think this will require in the future at least some elements of centralized governance, which could take the form of a coordinating office that maybe could be placed within ERN in the second phase of the project. Also, a regulatory framework binding to healthcare providers, coordinating centers, and industry partners to agree on standardized contracting could greatly facilitate interactions. So this is what my wish list looks like. Thank you.
Thank you. So are you saying that there isn't a clear ownership structure or governance structure around the ERNs? So now they are a little bit, some here, some there, and
we are not legal entities. So basically, the legal ownership is with the institution of the ERN coordinator. And so we have to do everything through the university hospitals. And in the early phase of the ERNs, we discussed whether the ERNs should become legal entities. At that time, we decided against this because it would also have meant that all the administrative burden of running the network, legal liability, everything would have been with the coordinators themselves.
But where does that sit now? Who has the legal ownership? Whatever.
It's still like this. It's still the hospitals, the institutions of the coordinators that have.
But this is an obvious place to start. To build up a structure with a clear ownership, with a clear mandate. And because, I mean, for me, I stem from the business world. For me, nothing is a no-brainer in this world, but it is so obvious that if we invested in this, we could actually achieve many things at one go. We could achieve a forefront in the digital. We could achieve a forefront in pharmaceuticals, cross-border, and we could, make the highway for so many areas, not only rare diseases at the end of the day, starting there, but it could really trickle into many other areas. But let's talk about that.
It will not save money, though. Be aware of that, because, we will have to have the lawyers that are now hired by the hospital. We would have to hire them. Sure. The administrators, we would have to hire them. So now much of the work that we are doing is covered by our university hospitals.
But let me just be inspired by, I know as we speak, they are building up now this 28th regime for businesses, so that you can run a business in the 28th regime, and then you have a true single market. Then you don't have to walk around and have all these difficulties. Mm-hmm. If we could find some of the inspiration in that idea, mm-hmm. and say, here we can create a second or whatever, mm-hmm. 29th system, mm-hmm. that is owned by us all together in Europe, has its own legal status. Mm-hmm. You get my point? Mm-hmm. Then it is also money saving. But for me, that's not crucial. For me, it's crucial that we get it right in working together.
We would be very open to that.
Yes. So I just wanted to comment on, or to add also on what Franz you were saying about the importance of the research activities from the European reference networks. And just wanted to say that when they were just created just before we were starting the European Joint Program on Rare Diseases. So at the time, it was also running in parallel, trying to see how we can work together. But what I can say that so it was very important, and we have taken on board the importance of the ERNs in research from the very beginning. And we can clearly see, because you are talking about together, but also cheaper or supporting the activities, is that indeed not only through the Horizon Europe, individual calls, but also as part of EJPRD and now ERDERA, we can clearly see also the shift in the participation of the ERNs in the research projects that we are financing. Mm-hmm. And so we could see the shift from already at the end of the EJPRD, about 40%. Now in the current call, we have 70% of the projects that are being submitted
with the component from the European Reference Network, still under the same hat as Franz was saying. So they indicate that they are part of the ERN, but these are individual research units that are part of the European Reference Network that participate in those projects. And you were talking also about the possibility of public-private collaborations and the clinical trials. We have next year plan to open the call for clinical trials. Maybe this could be also, and it is still in the preparation, so it could be also a potential opportunity to see again how we can exploit and leverage the potential of the European reference networks, building together also on the public-private collaborations to use the specific budget. Although, I mean, the budget that we plan to commit is 30 million euros that come directly from the Commission budget that is dedicated, and normally that should be given to us in the second installment. So I hope that the negotiations that we are having now about the budgets are not going to cut the second installment for ERDERA, because then we will be really in trouble. And maybe I wanted also to underline that this bridging healthcare and research, we also do it through the identification of key collaborations that we have to establish. And one of them is the collaboration between ERDERA and Jardin that has been also voted at the end of the first year of ERDERA as the collaboration that we need to now implement in practice. And that is currently also happening. So I think that we try to maximize as much as possible also the instruments that we have at hand.
Yeah, I am Anna Raz, I'm the director of Orphanet, and I want a little bit to challenge what Franz just said on the creating a legal entity with a shared governance that will create no new costs for all the legal paperwork and the legal framework and so on. Of course, it should be centralized and the organization should pay for that. But we as Orphanet, that is also kind of an ERN for data and information and codification, we just created our legal entity as a non-for-profit organization. And yes, we need to do all that work, but in reality, it saves money and time because you harmonize and you have one single entry point for the collaborations. So at the end of the day, the partners will invest on this structure that can have a shared governance by the institutions, with the oversee by the European Commission, and then everything is clear and transparent, and you avoid the waste of time and money because your institution are paying the lawyers, so there is money there that will be saved at the end of the day. So that is the experience we are doing with the Orphanet now, and that can be shared with the ERNs.
Yeah, I think the idea of a kind of shared legal entity could be a very attractive one.
I'm sorry to be the bad cop, but we need to move on to the next topic. We've had a really good conversation so far, and I'm glad we're able to tackle all these issues we've been discussing for a long time now on Together for Rare Diseases. But I wanted to quickly introduce Carmen Laplaza Santos, Head of Unit Health Innovations and Ecosystems at DG Research and Innovation of the European Commission, leading on the life sciences strategy. Carmen, I wanted to ask you, at a time where EU health policy is increasingly framed by our need to boost competitiveness, exemplified by the proposed European Competitiveness Fund, is the Commission looking at ways to increase the innovation and research potential of ERNs, and how do PPPs come to play here?
Thank you. Thanks a lot for the question, and thanks a lot for the invitation to this very important event and discussion. So before starting, I would like to bring a positive message. I think it's important it's good to have the need for fight, but also to recognize what can be on our hands in order to fight better. So we are in new times, right? We have this new commission, new parliament, and the competitiveness flag on top of us that I think we should embrace personally, for one very single reason. I mean, we are talking about rare diseases and we are talking about breakthrough therapies. But if the breakthrough therapies do not leave the lab, they will never save any life. And to go to leave the lab, they need to be supported by the industry to a certain extent. So I think that what is positive in this new competitiveness flag is that it will never have been easier to talk about collaborations between the industry and between the ERNs. I think there is no better time than now. Now it's really, so I think we should keep that on mind and bring it with us. I think that competitiveness is important also in the aspect that biotech is part of this competitiveness, has been indicated as a critical technology, and that's very important news for the rare disease ecosystem. So I think this is also another important news. There are discussions, there will be lots of discussions on the new MFF proposal. I'm sure this will be very complicated times, but good news there as well. I mean, we have heard how important is research for rare diseases patients. So, I mean, we could not have dreamt better for at least what is currently in the proposal. Yes, of course, you can always dream about 4 times the budget, but what is currently on the table is a very good number for starting the negotiations. So let's hope that, and for that, I agree with Stine, we will need all your voices to help us kind of defend that budget and ensure that the doubling of the research and innovation framework for program for the future is as much as possible maintained. You know as well how much rare diseases is one of the cornerstone health policies in the field of the research for the European Commission. And this is because we used you many times as example and as a motor to also bring forward other files. Daria just mentioned it now. I mean, the collaboration between the ERNs, the collaboration between Erdera and Jardin is so difficult to put in place in other files of health research. Here is like all the instruments, all the tools are there to bring the file forward, also with this kind of competitiveness flag. So I would like to really build on all those kind of positive messages. So in this flag of competitiveness, where biotech will be one of the 4 policy windows of the future European Competitiveness Fund, there are different strategies that the Commission is putting forward, and the life science one that was adopted in July is one of those. And it's very important for the rare disease community, I think, as well. Why? Because, I mean, you are a critical actor in this research and innovation ecosystem for life science that is critical, and it's one of the 3 pillars of this life science strategy. You have proof through the ERNs, how much you are at the same time a clinician and a researcher. So you are the kind of actor in this kind of ecosystem that is absolutely essential. Why we need a strong ecosystem? Because in order to have a really well operating life science sector, we need to have easy access to the data, to the tools, to the actors, and know with whom we can collaborate. So I think Frank has already mentioned the great things that the ERNs have done. And I was in the initial times with another hat from Connect at the start of the ERNs. And maybe you don't realize because you are in every day, but the progress that you have done is amazing. I mean, what you are describing about your participation in projects, in research projects, contributing in different, is not as minor as it's could sound. It's huge. I have here a list of examples of projects where you are delivering an amazing work. And also, something that was not yet mentioned is that you are already collaborating with the industry. There are beautiful examples in the context of the Innovative Health Initiative that I am sure others around the table will exemplify. But clinical trials, which is one of the ambitions where we hope we will be able to do something in the next months, whether in the Biotech Act, in the follow-up and implementation of the life sciences strategy. You, again, are the example of what should be done. I mean, projects like Connect for Children, where you are building really the clinical trial readiness in order to ensure that the clinical trials can be done and can be done in Europe. These are beautiful examples that need to be continued. So I think that it's not where we are going to start, but how this is going to be followed, who is going to fund for that, and how you are going to keep all the energy that is necessary to continue doing this work. So from our side, you can count on us. We will keep the flag of defending the importance, not only for the rare disease patients, which already is super important, but for all the rest, because you are really the good example to build on for the competitiveness as well. And of course, there are many different initiatives. We count on you also to help us in the implementation of these initiatives. The only plea I would do now is that the Biotech, very important, is currently in public consultation. Well, not the Biotech Act, but we are collecting the input. So please, this is open until the 10th of November. We are working closely together with our colleagues of DG Santé who shape the field. But I think this is an important opportunity so that you help us knowing what needs to be done from the regulatory perspective, but also from the non-regulatory perspective to facilitate your work, to facilitate the ecosystem, and to ensure that life science, research and innovation is still in Europe, but even comes back to Europe. And I think that I just forgot to mention this message about Use Europe, but this is extremely important because if ultimately clinical trials do not happen in Europe, that will be a big loss for all patients, but especially for the rare disease ones. So, and that's all for the time being. Thank you.
Thank you so much, Carmen. We've heard the perspective from the ERNs, we've heard the Commission and the Parliament, but of course PPPs would not be PPPs without companies and industry. So Ton, who's also a member of Together for Rare's steering group, but head of public affairs and public policy, Europe and Canada at Takeda, and a member of EUCOPE. It would be great to hear from you, Ton, about what you see from a company perspective. What is it that companies can bring and need to bring to public-private partnerships, and why is it so important to involve them in those types of collaborations?
Thank you, Clara. And if you allow me, I wanted to take you all back to last week, to Copenhagen. Stine referred already to the Nordic Rare Disease Summit. It was a successful meeting. You had 20 different stakeholders across the ecosystem supporting it. But it was also a very special moment that I want to kind of talk about. It was the visit of Queen Mary, who is the patroness also of Rare Disease Denmark. And the moment where you had 500 people standing up in that room, welcoming her, to me, the energy in that room showed the strength of this community coming together. And why am I telling this? I think it is because stakeholders working together, partnership, multi-stakeholder participation, governance is a trend that will be becoming more and more important in this complex external environment that we're living in. If I look back at the award's foresight study, 2030, that was presented some years ago now, but one of the key trends identified there was the rising importance of multi-stakeholder governance. We will have to do this ourselves. We don't always need new legislations. We can also do things as a community ourselves. I think that's the first point I wanted to make. Obviously, in terms of public-private partnerships, there's so many kinds and forms in those, smaller ones, bigger ones. But I think what also in this community is a strength is there's always interconnectivity between those. And if we look at the one that where we're convened today, Together for Rare Disease, it is by itself a smaller one, right? It's a smaller one, it's a bespoke partnership, but it is connecting, as Sheila was saying, it is connecting also with bigger partnerships, some of the dots. But because of its agility, I think this partnership has moved the needle in a number of important areas. And allow me to mention two. I think the first one is around awareness communication. I think, Frans, when you were saying about we need to have this coordination office, or I think indeed, to unlock the opportunity, having had the secretariat that brought parties together, create that awareness, it helps to unlock the potential of these European reference networks. We could feel that when we were working on it. And then secondly, in terms of the governance and the operational framework, again, the standardized contracting is one of them. Sheila talked through the toolkit. There's a lot of these recommendations that we can pick up today that could make a real difference to further strengthen ERN collaboration with industry. So we hope that we can build on that and take it forward. And then maybe last but not least, I cannot make an intervention without talking about the importance of keeping these topics high on the political agenda. And I want to thank MEP Kulja and MEP Bosse for doing so. They've done already a lot in this field, but I think we need to take it a step further. We need this European Action Plan on Rare Diseases to create further momentum. Let's continue talking about it until we get there. And then obviously on the files that you mentioned, the pharma package, the Biotech Act consultation, the life science strategy, these are also the opportunities that will help us to make sure that Europe remains competitive globally. And that's, I think, a duty we have upon us. So thank you.
Thank you, Toon. Any comments? Anyone would like to intervene? Then another industry perspective would be really important, but just from the pharmaceutical perspective as a whole, Magda, as Executive Director and of Science Policy and Regulatory Affairs at FPA, you've been involved in a lot of PPPs, and it would be great to understand from a pharma perspective industry, what do you need to be more and better involved in PPPs?
Thank you. And indeed, I've been doing public-private partnerships since 2008 and in various configurations, both bilateral, institutional, lighter, heavier. I think I wouldn't say what we need in order to better engage. I think what we need in order to create better traction for public-private partnerships to be created. And I would like to really highlight what Franz said about we do not only need to remove or amend the statement that prevents us from collaboration, but we also would need a very clear traction from funders and decision makers saying that public-private collaboration is one of our tools to achieve the objectives that we have. Because it's very easy to say, do public-private collaboration, but at the same time, if you are not encouraging it, it's not happening organically. And why not? Because it is not required. And if it's not required, then it's not happening. I'm not saying that it needs to happen everywhere, but what's needed is a clear signal that demystifies and removes this stigma of there is something fishy there or there are conflicts of interest. So I think if decision makers and funders of research were saying that for achieving the objectives of certain projects, we need to create public-private collaboration, I think that would completely change the way that they are seen today as maybe an opportunity to them being a real tool to achieving progress. And I would also like to highlight what you've said, Carmen, about let's embrace the competitiveness agenda. I do not necessarily agree with the concerns that competitiveness is just late-stage development of products. I think competitiveness agenda means competitive ecosystem environment for conducting research as effectively as possible. And that means infrastructures that can achieve that. That means ERNs, that means clinical research networks, that means a translational research infrastructure. And the reason why we need to be very flexible in Europe and co-create this infrastructure together is because we need to be much better, and that was in the Draghi report and elsewhere, at doing translation of ideas into the industrialization where this industrialization is possible. And that would not happen just by chance and serendipity. It's going to happen when we co-create this infrastructure together so that we can make them regulatory ready, industrial ready, science robust, and where we can respond to the imperatives of everybody. I have plenty of ideas of what can be done, but just to tell you, it's not just about the general pharmaceutical legislation, which might help some of that.
the Biotech Act, which many people mentioned, but also the Innovation Act today on the table with the consultations. Implementation of EHDS would do a lot in making or breaking the possibility to work together. I'm not seeing a TEDAS on rare disease yet. Why? The scale-up strategy, the infrastructure strategy, I think the Commission, and we should be grateful for that, although it's pain in the neck to respond to all consultations, but opened so many doors today. We just need to make sure that we ask for the right things in the right legislations, and that we ask for a ring-fenced budget in the MFF for health, and possibly also for these health infrastructures that would make Europe more competitive. Now, I would like to maybe say something that nobody has talked about yet, is the MFF. Because I think where Europe cannot compete with US, China, or these one country structures, which can be much faster than us, we have the strength of collaboration in Europe. It's unprecedented. Nobody in the world is doing as much collaboration as we do. Why don't we just do it better? So I'm trying to be positive, Carmen. So we have that, and the other thing is experimentation, but we are not that good there. So why can't we combine experimentation and collaboration and create a financial framework that allows us for more dare to try approaches, where we can, if we understand, and again, many people said there is no one model of public-private collaboration, there are many models of public-private collaboration. So why not create a framework that allows for experimentation? You can't have one size fits all where every collaboration needs to happen on exactly the same model. It simply doesn't work. By the way, many framework programs are created based on the academic needs, not on the needs of public and private. And that needs to change as well, because the economic reality of economic operators is not the reality of academic operators or patient organizations or doctors' organizations. So if we want to do something good, and if you read the documents of MFF, and I encourage you to read them, I think we should be concerned about some words like single rule book. I understand simplification is needed, but if we squeeze everything in the same set of rules, forget about public-private collaboration, not going to happen. And we need public-private collaboration because we need progress in translation and clinical research. And having seen so many success stories, I think, why don't we take the best practices from each of them and turn them into a legislation that makes sense? Because there is a lot of excellent examples of these that can happen. So I would just really call for more flexibility, to try place for experimentation. And, we've managed to enter into ERDERA, for example, but it wasn't without a little fight. We've managed to create public-private collaborations in different places, but we had to push doors and convince people that public-private collaboration is not a risk, it's not a liability, but it's a real opportunity. I list them again: Biotech Act, Innovation Act, EHDS implementation, scale-up strategy, infrastructure strategy, and MFF, because without money, it's not going to happen. And ERNs are an essential infrastructure. The clinical research network would become the infrastructure. We need to make sure that we have money and muscle behind them. Can I say more?
Just to ask you a clarifying question, I think it was absolutely sweet music in the ears, but you do agree that for the infrastructure bit and for the ERN systems and so on, talking about one rule book sounds perhaps a little bit sort of dictating stuff, but to have a common system, a common model for governing and so on and so forth, and then building on that, making sure that actually fuels creativity and the private-public partnership. Did I get that correct?
Yes, exactly. And I think that when I was talking about single rule book, I was thinking about the MFF single rule book for financial rules, which is slightly different from what we were talking about, streamlining the processes that govern the ERN. So it's not exactly the same thing. But today, if you look at framework programs, everything must look exactly the same in the way you can create collaborations, in the way you create your consortia. I mean, you need to tick so many boxes that it loses in the end the flexibility that needs in order to do something. So I completely with you. And then the separate item is the single rule book in the MFF.
Can I intervene into your presentation? Because, you know, I am together with Maurizio Scarpa. We can announce that we will organize on 10th, 9th, and 11th of December a high-level ministerial meeting, uniting our efforts to move forward with the idea to build pan-European ecosystem or supranational space which can allow us to implement that idea by fifth, freedom of research, investment, and innovations. Such freedom requires ecosystems and infrastructures. Second, keeping in mind the Draghi report and keeping in mind a Hater report, manual Hater report, act, align, accelerate, who knows very well, because he is assessed very in thorough manner, situation with horizons and so on and so on. We're just proposing, you know, we are arguing about necessity not to go into silo, but to see how can we join our forces and provide very excellent 3 days meeting. And I will be more than happy to have you as speaker. Of course, because you just mentioned all issues which are absolutely clear for me. You know that I proposed several times the subcommittee situation was not keen to develop a rare disease strategy. It's a different one. But when we're speaking about infrastructure, we can use European reference networks as part of existing AI situations, biobanks, biomarkers, you know, because without them, you have no chance to speak about clinical trials. Of course, also health technology assessment, health data spaces, and of course, we need to assess all legal frames, allowing us to motivate and to really build such infrastructure moving forward. And I am so happy. Invite you all, be very active, look into agenda, see how can we proceed, and I will be more than happy that Maurizio also tell you something about that, because it is our obligation. And when you mentioned MFF, yes, it is up to us now. First of all, I can draw attention of Stine. Your country is presidency country. I proposed to include discussions about infrastructure into your presidency agenda, but they do not accept it. They now think about a regional rare disease strategy. They do not understand a little bit that region belongs Baltic Sea, Poland, Germany, the Baltic Sea region, but they are still a Nordic Council. Okay, it's up to but I propose to include, why? Because the next presidency is Cyprus, and then trio, Ireland, Lithuania, Greece. I am trying to convince Lithuania to include it into presidency agendas trio, because MFF will go through such trio. And we have good opportunity now to join our all parliamentary forces. Not only some committee, but several committees, because it is ITRA committee, different committees. We can encourage STOA also to discuss about. But it would be a big mistake, lost opportunities to use such momentum and go from talking shops to actions. Because I spent a lot of hours in talking shops, you know, but I can tell you, and of course also I can raising questions once again. Please understand, we have international strategy on rare disease. We have big market globally, but in EU you have two types of countries: small countries, and those who do not understand that they are small and they have no chance to solve problems with research, investment, innovations, and no one. France, Germany solved it. We need to overcome old paradigm of healthcare is member states' competence. Yes, it is partially. But healthcare is also EU competence, and we need to reconnect those two situations and really achieve best results. Time is to act. Time is to act. We need to be more clear. Thanks a lot. I talked way heavy.
No, I just wanted to mention to you, I totally agree. You know this, we've debated it before, and I am fully aware that also my country is not, in my opinion, completely right in saying, you know, I just attended a meeting in Stockholm on Monday, and this was about Swedish-Danish partnership. I mean, that's not enough. So I'm completely with you. And to try and get, and we can definitely use the rare diseases area as the core, and then from there develop further to show that there are so many areas where working together closer really makes a lot of sense.
Thank you. I would like to now give the floor to Rosa Castro, Public Affairs Director at Eurordis. Obviously, Eurordis has been has been at the forefront of pushing these policy issues in the past, and we would really like to hear more, Rosa, about all the work Eurordis will be doing through the MEP interest group and on cancer and rare diseases. Sorry. So it would be great to hear from you on that in particular, but in general on the work you've been doing. Thank you.
Thank you. Thanks so much for the invitation to join this important dialogue. I have to say, maybe if you allow me, just a quick thought, personal one, because I kind of recently joined Eurordis, so I'm kind of new to the rare disease world, not new to the EU health. And one of the European reference networks, I was just saying that before this meeting, are always cited as the best example ever of EU actions in health. So I think, that's something that probably we should fight for keeping in the long term. So now going into the Eurordis point, which I work with people that know about this for many years. I think the main message that probably we want to share is one that you have already shared. MEP Stine Bosse, we know that we can count on you, on MEP Andrew Katis and MEP Kulja on the EU action plan for rare diseases. And why we don't think, we're now thinking about what should be in the plan. To be honest, we know that the support has been growing, and I don't want to repeat because probably you know it better. A series of conferences and different presidencies have expressed their support. The Parliament and the champions, including the ones in the intergroup on rare diseases and cancer, have expressed their support, are working on different reports. I think we have consensus in this room, so there is no need. But the one thing that we have been talking with other stakeholders and that we are thinking about how to do is the next step. How do we prepare for this plan? So we are trying to convene all the stakeholders. This is part actually of the next conference on rare diseases next year. It's early thinking, but I invite you to also get in touch to share your ideas on what should be in the plan. We believe that at the minimum, that plan should be the glue that binds together what exists and what is being working. And you know it better, right? So the European reference networks, which are the links between the clinical work for the patients, but also research, as I heard and learned about today. But also ERDERA, which provides that research backbone very clearly since the beginning. And also, very importantly, the public-private partnerships, which also link and give the push and will make sure that those innovations finally reach the patients, because that's for patients the most important side of all of this. We think obviously this needs dedicated funding. So we are thinking about, we are happy to hear that everyone is pointing out to the need for that EU action plan to be there in the MFF, to the MFF to consider that action plan. Without funding, without long-term funding for all these pieces, nothing will be, I mean, all the good things will disappear. So I don't want to repeat, but maybe let me just mention Jardin, which many of you mentioned as well. The joint action is great to integrate all of this work at national level, but that's running until 2027. What happens afterwards? So that's, that's why we need to go to the MFF. Maybe one point is about patients themselves. We also need to be supported and funded, and right now that's not very clear because of you probably know it, but the loss of the operating grants for health NGOs, including patients, is just bad. Long run, we will be less able to participate in a lot of these. And that leads me to the next message. Of course, all European reference networks, ERDERA, have included patients, but we need to move forward also towards the formalization of those relationships. So that works in a bit of an ad hoc way, and it works well, but it should be formalized with, clear funding, long run for the patients themselves, and of course, for all the reference network. Some of you also mentioned data, and that's of course a great point and an opportunity for all of us in the European health data space to ensure really that ERNs and rare disease registries have the resources to really make use of all the opportunities in the European health data space. So I think I can wrap up here. I think our hope is that these repeated calls for the EU Action Plan now materialize, the Biotech Act, the MFF. We are looking into all the possibilities with you, hopefully. Thank you.
I think, thank you for your words. I think it is really, really troubling to see how patients' influence is actually being taken down. It also concerns me that the representation on EMA is now being debated, and I just don't get it. I mean, I haven't been working with health all my life. I've been doing a lot of other areas, and I can only tell you that the engagement, the knowledge, the richness of ideas and solutions and so on is huge with all the patients' organizations that I've met. And I just cannot, it doesn't get into my brain why that should not be in a positive way utilized. I just don't get it. And it will lower the standards in all areas, and it will, it would rise risks in many areas as well. So I just don't get it. And I think, also there, it is so important that you speak up, because it's so important for us also that we can show, where does this stem from? Where does it come from? Who is this? Who gets these silly ideas? Sorry.
I had a bit of a follow-up question from what Magda said earlier about public-private partnerships not being a risk or a liability. And I was wondering, Lina, in the work you do, in your region on public-private partnerships, whether you would agree with Magda's statement, and what are the success factors of public-private partnerships and lessons learned?
Thank you very much for addressing us, and thank you for our hosts. It's an honor to be here. So I think we can all agree that we really, for Europe and for the competitiveness agenda, which we will feed into somehow, need these excellent driven ecosystems that are based on user-inspired needs. If we finance that, we can accomplish so much more. And there are, of course, several public-private partnerships also within the region where I sit, but specifically I would like to mention here the public-private partnership between the Novo Nordisk Foundation and our university sector in Denmark, where we have been driving open innovation and science platforms now for 5 years, and we accomplished quite a lot with limited funding. So I think these are examples of how we can do open knowledge generation. So everything we produce is entirely open. It's ease of collaboration. We have one single standard agreement that all legal entities coming into our partnership must sign. So usually when we have ideation sessions, matchmakings, you will have companies in the room asking, what are we waiting for? When can we get started? And we look at them and say, well, when you have read our 15 pages, then we get going. So I think that is to reverse the logic that we usually come into when we come into public-private partnerships. So that's really what we do this for. And we started this collaboration with the Novo Nordisk Foundation with a joint vision of opening up universities, because what we have experienced over the years was that it was also, usually at least, very transactional, very closed, and here we did it exactly the opposite. We opened everything up. Everything has to be based on an industry need, otherwise we do not start the project. And just as a small example, the first 3-year project, which we did as a pilot with the foundation, it was less than 7 million euros. We worked together with 44 companies of all sizes, from startups to multinationals. And we had more than 111 senior researchers. So here we are not counting the PhDs, they're not researchers, but we didn't count them in this. So that proved to us that with very little money, we can de-risk seriously. And you are all professionals. You know how many failures you need to go through to make it through the clinical trials. But here we helped companies of all sizes de-risk their business. And we put at hand for them a wealth of knowledge that they would not normally have been exposed to, because they were part of projects that they had been negotiating and co-creating with other companies and researchers. So I'm just saying this is an example, not to promote this particular project, but to promote the method and the thinking behind, because that's what we need. And we are now in a process of talking to European research infrastructures, and we hope that this will be the beginning of a conversation with the ERNs, because we can definitely learn from each other. So we are here to help and serve. So thank you for the question.
Thank you so much, Ina. And a follow-up question on this. We've heard from the ERNs, we've heard from industry, but also the patient voice is really important in research. And I was wondering that on public-private partnerships, obviously not only ERNs and industry are important, it's the patient community that brings a lot to the discussion. I was wondering how you navigate all the maze of creating, operating, and then implementing the outcomes. This was really good. Was this a question for me? I'm not sure.
Sorry, I didn't hear. Anyway, thank you. Good afternoon to all. Thank you for the invitation. I'm the president of European MG Association, and we have managed to establish quite a community in the last 2 years. Some of us are part of the ERNs. Some of us have even been to the meetings. But working together with private and public, for us for the moment, we are doing most of the project with private. We are part of the ERNs, which we are working in neuromuscular junction diseases. We are working on the registries, European registries for MG patients, but we are also working together on most of the projects with industry. And if you ask me what goes most smooth, I will say industry. Sorry to say that. But they give us the opportunity to do projects we would never been able to do with public institutions. Before I continue, I just want to say to you, MEP Bosse, I was happy to hear you say people would go where they are helped the best. Well, we are striving for a better cross-border treatment for years. It's something we asked for years, and maybe focused on MG, but I think it's for all rare diseases. And I think the outcomes for patients would be more, it would be a tremendous advance, because now we have difficulties to refer people to the good centers because there's too much bureaucracy in their own countries. And we were able to help a little child from Croatia to have a treatment in the Netherlands. But that's just one case, but there are a lot of cases. And I had the opportunity to speak to MEP Jerkovic as well in June. And I was explaining to her that there are non-invasive treatments for a thymectomy, but she didn't know. And we are working with robots here, and they still open the chest. So for a little child, it's very invasive. Those are things I want to point out again, that it's very important to have a better cross-border treatment. Also, a small thing, recognition of patients. There is a European disability card, which is just enrolled in 8 countries in Europe. So where are the other 19? So those are just small things. We are asking for a few years. And I agree on what you are saying. We can save money by working together. I'm convinced about that. But we should also allow some intervention of pharmaceutical companies to make it easier, because they have the money to fund us and not the public sector. I'm so sorry. I hope I didn't hurt anyone.
I want to continue on your note, and thank you very much for your words there. Can we have Chatham rules just for the next 3 minutes? Because my experience up till now has been, when I talk with all you clever people, it's all about, yes, let's find solutions. Let's just, we forget about borders and who decides and so on. The same happens when I speak with hospitals, with regions. The same happens when I intervene with the Commission. I mean, same attitude. But there is a problem when we go to the nations.
Yeah.
And we can only again solve this together by addressing it and saying to the politicians in countries, we're not here to take away your power. We don't want to discuss who decides. We are here to create solutions for citizens. And we need that attitude to sink in, because otherwise we will be stuck. And I mean, my country, the country that's probably one of the ones that can really afford this, even there we have a discussion. Mm-hmm. So then when I think about it, imagine Romania, Bulgaria, many other countries, and we've got to get beyond this for the sake of citizens and for the sake of, and I mean, if we really want to be different, and I think we do, from the ones that we're competing with, US and China, we keep citizens top of mind in everything we do. And then, of course, we engage with businesses and make sure that they are on board. Mm-hmm. And they are the key. I can only say that's also part of my experience up till now. And I want to share with you also on that note, of course, rare diseases is key for the pharmaceutical sector. Let's be honest, why? Because personalized medicines, rare diseases, a lot of it is personalized medicines, is the next way of curing cancer, for example, or many other diseases. So let's grow that awareness also on the country level.
There should be a change of mind in a lot of things. And sometimes we as patients see things more simple, because we are not thinking of all the different within boards and whatever there are. But in public sector, we experience a more closed, as one of people told, a more closed attitude. And that's something which is, with the people we work together with pharmacy, it's very transparent, because be transparent is looking at what they are doing. So that's one of those things which makes it easier for us as well. And they put us from the beginning in everything, because we are now working to be at the beginning of the developments of trials. We will be there as patients. So I think it's a great thing.
So I have two questions actually, but I start maybe by saying that we need more Europe in Europe for many things. Because for the moment, the fragmentation is not making Europe competitive, but most importantly, it really does not help the patients to get what they need. And you were talking about access to treatment. I would like to highlight access to clinical trials as well, because cross-border trials is a big problem. And a little bit of a promotion with EFGCP and FPA, we've done an initiative on cross-border clinical trials where 10 principles have been defined on how to facilitate cross-border access to trials. And I know that many organizations have their own principles, but we need to start implementing those. And as you rightly said, a lot of questions are at national level. It is around social security, it is about liability rules, it is about all of that that prevents us from going faster. And I'm not even talking about the slowness of clinical trials approval, because that's something that I understand from the Commission will be resolved would be resolved. So my question on this account of cross-border access to clinical trials, is there something that can be done, well, first politically, in terms of that's one question to you, but the same question also to Erdera. And is there something that we can do collectively in order to start really making a difference? Because that's also related to ERNs and to the way they can collaborate and to the point that you've said about joining forces. I have another question for later about deployment of results, but I skip it for now.
If that was a question for me, yes, I think there's a lot we can do together. And I think sessions like this, and then perhaps some of us can continue the conversation, because some of the ideas that we could bring onto the Commission to say, come up with this idea, and then we can support it politically. And you can support it from wherever you stem. On, for example, having this, it's just an idea, but this regime that would sort of break down the walls and say, if you do it within this regime, that's the new legislation platform to make sure that we can actually sort of cross some of the borders in a new way.
I think we are doing sandboxes, right? A lot of them. There is a lot of conversation. Maybe that's something that we should envision, a kind of a sandbox to do it in safe environment and to pilot. But I don't know, Daria, if you want to say something about Erdera.
Well, so when it comes to the cross-border and clinical trials, so obviously this is something that the recommendations that were issued is something that we took on board for the development of the coming call for clinical trials. How successful we are going to be when it comes, and I think that here we also look into the direction of the European reference networks, because you have also the power to make sure that these are successful. And so we also learn based on the previous, more or less, rather less successful experience in financing of the multinational clinical trials, and how many of them in a way failed also because of the fact that we had no joint budgets and this kind of thing. So these were alleviated in a way through what we will do in Erdera. But it's true that when we were discussing about the recommendations and also talking about some examples for some of the clinical trials, we were also told that sometimes it's easier to do things in one center and bring all patients in the same place rather than do it in 5 or 10 different countries. This is not definitely the solution, but it is just that the desperation in a way of, how difficult sometimes it may be when it comes to implement the clinical trials. So that's why we decided to take time before we open the call. So to make sure that we have everything at hand and we understand the environment to make the framework for this call as useful, but also flexible, not too rigid, to not to block also the good ideas. So this is for the moment where we go.
May I have a comment? There is a conflict.
No conflict. No, just a comment from the ERN's point of view. There we have the registries, and if we strengthen the registries, we will have patients that can, throughout Europe, cross-border, that can access clinical trials. We have in our registry, in the informed consent, we include, do you want to be contacted for clinical trials? 95% of the patients say yes. And of course, if companies approach us, we direct them to the sites where the patients are. So that's what we're trying to do. And it will take just more patients in the registries, in all registries, to be successful.
May I also make a comment?
Yes.
It's fine. Ladies first.
Thank you, Maurizio. So, may I reflect shortly on the word that was raised here at last, equity. ERNs were supposed actually to diminish gaps across Europe. And I will raise now with the head of a person from underrepresented country, not BOMS, sorry, a very uncomfortable question. Did they decrease or increase the gap? Just because participation in ERNs is on voluntary basis, participation in all other activities is voluntary, and we have really very, very whitish spots that so brightly shine in European map, and we do not have any instruments except from just discussions to encourage.
Yes, thank you. So you have heard regarding the fact that Erdera and the ERNs are ready to help, because you were actually making a very important and the crucial question in terms of rare diseases, because we need to have therapies and we need to have clinical trial for therapies. I think that what we need, beside the specific things that we are doing, is a little bit to change the mentality of how Europe is dealing with this kind of issue. Because we have all the instruments, we have the ERNs, we have the projects that are devoted also to create new clinical trial designs. There is the Realize project that is mapping all the clinical trials in Europe to create also new phase 1 and phase 2 clinical trials in Europe. But actually what we need to do is actually to have Europe saying we can compete with US. We are in the same situation or better or even cheaper to host phase 1 trials instead of always waiting 3, 5, 10 years before we have a therapy or a trial in Europe. So it's a matter of using the ERNs as a message, as an ambassador of competence, of sustainability, because we are structure, we are hospitals that always worked in this field and will continue to work. Of course, if we are not sustained with money and we come with MFF, everything will be out, but we are the hospital and we are the one making the diagnosis, knowing the patients, having the registry, going to work with the companies and making the clinical trials, and give also the ideas to company how to do clinical trials and how to develop therapies, what it is needed. So I think that we need to change a little bit the attitude and have not only the ERNs or the project to create awareness, but together with the council, with the parliament, with the commission, really to raise our hand. And this is why I'm happy that MEP Andriukaitis was engaged so much in this idea to have this big meeting, because that is the moment in which we can really create the critical mass and work together with the politicians to help the physicians and the patients to be helped. So it is really, we have everything. Let's create the puzzle and let's show that the puzzle to companies and to US is appealing and it is able to make the difference.
If I may, can I add a little bit? Because today on Sunday it was excellent meeting where FPA presented some figures related to the situation between US and EU trade in the area of biosimilar generics and medical devices. Oh yes, I can tell you, Do you hear something that, we are losing our competition in the area of pharmacies, medical devices, or you heard, look, we are losing competence in car industry. Which voice is much loudly at EU level? Tell me. Or also, you can imagine if something will happen with agricultural policy, how many tractors would be here around us? Yes or no? But now when we are sitting here and talking, and of course one very important word is voluntary. My question is to you all, do you know how many times ministers of health, together with ministers of finance, together with ministers of economy, together with ministers of innovations, are sitting around and discussing Mauricio question? Are we ready to compete with China, US, and India? And this is really question number one in area which is one of the biggest areas in Europe. European economic structure, health sector is one of the biggest sectors, and he's never stopped, in growing related to labor force and related to export. And now FPA presented figures, how many cars we are exporting to United States in figures, and how many medicines, devices, cars, 53 billion. Pharmaceuticals, 200. But cars are on every corner, especially in Germany. But medical devices is nothing in this. Do you see situations? And of course, ministers of health are gathering one time per half a year in Brussels. One time. Ministers of agriculture, minimum 12. Ministers of economy and finance, minimum 12. Why? Because it is national competence. Because we are all blind. Because it's voluntary. But it's okay. You are doing on voluntary basis. But why are ministers not gathering on voluntary basis 12 times per year in Brussels? That is a question. And I am arguing about necessity to improve Lisbon Treaty, because it should be held as an aim of European Union policies, especially now globally, not as an ancillary issue or only partially cross-border healthcare threats issue. It's not enough. I am keen, once again, to raise questions about European Health Union, about our strengths, because we are so powerful and change situation. And now it's up to us all in our committee. But because we are losing, with business as usual, we are losing strategic lines and possibilities to achieve something. Sorry to say, so it's very open. And please remember such word voluntary, and European reference networks and voluntary basis are so poor, so weak, so can you imagine how they can spend hours in diagnosis and then asking, who is paid? Who will pay for it? No one. You are brilliant. You are doing your job on voluntary basis. But we have no chance to move forward in such direction. And we need to say it to Commission, to Council directly, and in this House. Time is over.
Flaminia, just one last comment, and then we'll wrap up the discussion and move to the closing remarks from MEP Kulja. Go ahead.
Yeah, no, I just wanted to give a little bit of positiveness maybe, and a little bit of historical perspective, because the original discussions around the ERNs, they were really forward-looking. I'd just like to remind that the discussions on the ERNs started at the time where almost no one was really talking about rare diseases in 2004, under the high-level group on health services and medical care. And from there, we went to the Cross-Border Healthcare Directive that provided the legal basis for the ERNs that were finally launched in 2017. And within those very early time discussions, there was, yes, multidisciplinary care. There was the mobility of expertise, the cross-border care aspect. There was data and knowledge sharing. There was the pooling of expertise to improve diagnosis. There was the training, and there was also research aspects. I mean, I remember I don't know if you remember, we talked about one-stop shop for research partners, including industry. I just wanted to remind that perspective. Thank you.
And on that note, we need to wrap up the discussion, but thank you all very much for the great contributions. We definitely have a lot of work ahead of us, so we'll make sure to share all the different actions and clear actions that you all shared. I would like to now hand the floor to our co-host, MEP Kulja, who's a member of the SAN committee and a doctor by training. MEP Kulja, how do you advance what we've just discussed into the EU competitiveness agenda?
Thank you. It's always a difficult task to closing remarks, and really want to thank you for this very valuable discussion, and it has been a pleasure to join you today and together with my dear colleague Stine Bosse was this very important event on future of rare disease research and innovation in Europe. And I'm very happy that former commissioner, a very passionate and committed MEP and doctor colleague with András has joined to us. And actually we are representing three big groups of the European Parliament with, I think, 401 members. So, So, as both a medical doctor by background and a member of the Parliament, I approach this issue with a dual perspective. The practical realities of patients and healthcare providers, and the responsibility we hold as policymakers to create the framework that enable innovation, investment, and meaningful progress. So, as many of you mentioned here today, for people living with rare disease, the priorities are clear: access to treatment, access to treatments that do not exist yet, but they are under development, better coordination of care, and access to specialists. This is where Europe's investment in European reference networks, research infrastructures, and centers of excellence can truly deliver if we work together. So ERNs must not only remain the backbone of rare disease care, but also evolve in engines of research and innovation. And if we are serious about the competitiveness in the next multi-annual financial framework, then research, innovation, and patient benefit must be embedded into ERN's missions. Investment into ERNs and infrastructures like Jardin, which was mentioned many times today, must be translated into therapies and improved care pathways. And this is exactly why, in the SANT opinion on the general budget of the European Union for the financial year 2026, we called for increased and sustained support for the European reference networks and strengthening clinical collaboration across member states. Also across political parties and with the greatest support from EPP colleagues, we called for increased funding to targeted measures to improve access to high quality healthcare services, innovation treatments for rare diseases, and enhanced digital health, including early diagnosis and preventive care. So, as you are aware, EU Rare Disease Action Plan has long been advocated by many of us across political groups. I joined the European Parliament only 1 year ago, but for me it's also a very important topic, because I really truly believe that the problems we face on the field of rare diseases, we will face the same problems in the next years in cancer treatments, autoimmune treatments, because the therapies are more and more specific, personalized, and at the end of the day, almost every type and subtype of cancer will be a rare disease because of the number of the patients and the very specific and targeted therapies. So I think the momentum is growing across Europe, but as Vitanis mentioned, we need to work together and keep this momentum because in this geopolitical situation, the health is not the first thing that people start thinking about. And we must highlight how important this is. And there are more and more studies that show that where access to healthcare and quality of healthcare system decreases, the populism and support of extremist parties is growing. And it is a real danger to Europe and the democratic values in Europe. Now we have a SANT committee as a separate committee with a full legislative power, and the first time we will have an INI report on rare disease as part of the parliamentary work of the SANT committee, with reference to orphan drugs and the need for more investment addressed both in GPL and as well as the CME Act. So the momentum is there, and our reporter, Mr. Sokol, extended the scope of the medical products of common interest to orphan medical products as well, and I think it's important to mention. So, and the recent Rare Disease Summit and the upcoming Life Sciences Summit in the Copenhagen and upcoming discussion in the Parliament all point in the same direction. Rare disease and treatment cannot succeed without pan-European collaboration. So a dedicated action plan would not only accelerate research, but attract global investment, making Europe an attractive place for pharmaceutical innovation, because there is the possibility and everything is given for that. It would signal that Europe is committed to providing both the regulatory certainty and the policy ambition needed to bring therapies from the lab to the patients. As a member of the SANT Committee and the Cancer and Rare Disease Intergroup, I'm really committed to maintain political momentum with my colleagues and ensuring dialogue with the Commission and exploring every proposal that could help research and innovation to thrive in Europe. And I would like to mention one thing that was mentioned many times today, the essential role of public-private partnership, because no single sector can solve the complexity of rare disease research alone. We must encourage meaningful outcomes-oriented and transparent collaboration between ERNs and industry. And as it was mentioned, we also should have to optimize the structure of European reference networks. So, because small patient populations, fragmented policy, and limited funding remains a barrier, and we have to work to expand the possibilities. But maybe, and I think with the upcoming Biotech Act and the new pharma package, Europe has an opportunity to show that it welcomes and facilitates private investment in rare disease field. And scientific breakthroughs have always been the result of collaboration. The history really showed us, and by bringing together public expertise, private investments, patients' involvement, we can create a sustainable innovation that changes and saves lives. So The dialogue between policymakers, researchers, industry, patients is not just welcome, it is essential. And if we align our legislative framework, strengthen infrastructures and build effective partnership, Europe can lead the way in rare disease innovation, resilience and competitiveness. And especially in this geopolitical situation, there is a window of possibility to grab this chance. Let us work together to ensure that people living with rare diseases are not left behind, but instead are the forefront of European health strategy that is ambitious, inclusive, and future-facing. Thank you.
Thank you so much, MEP Kulja. Before handing over the floor to my colleague, Sheila Upadhyay, Chair of Together for Rare Diseases, I would like to take just a second to thank our MEP champions for co-hosting the event. We know how busy you are, but we really appreciate the effort and this was a much needed conversation. So thank you so much for taking the time. And also MEP Andriukaitis for joining the meeting. We would also like to thank your teams. Dana, Danai, and Boris have been amazing at helping set up this meeting. So thank you so much. And then to all our participants around the table, thank you. Clearly, there's still a lot of work to be done, and we will make sure to, as I said before, share all the outcomes from this meeting and make sure that we continue to push in the right direction for rare disease research in Europe. And now give the floor to Sheila, and then we'll work.
Thanks, Clara. And as Chair for Together for Rare Diseases, I want to thank everybody who's been part of this journey. It's been a really great learning experience, and I hope that today we have exposed some of the challenges, but also the massive opportunity that we have in enabling public-private partnerships and the opportunities that Europe have if they were to work together to deliver on these. And something somebody said earlier when I was speaking to them is that actually good health of our nation can contribute to the wealth and growth. So let's think about how we can collaborate together to build good health of our nation so that we can continue to grow as a nation collectively. Thank you so much, everybody.